This course provides general caregiver education and is not individualized medical, pharmacy, toxicology, or emergency advice. Follow current prescription labels, the older adult's care plan, and instructions from the pharmacist and prescriber. Do not start, stop, or change a medicine unless confirmed safe. Welcome to Lesson 13 of the Family Caregiving Program, Medication Management and Safety. Medicines can protect health, relieve symptoms, and preserve independence. They can also cause harm when the wrong medicine, dose, person, time, or route is involved, or when several products interact. Older adults may be especially sensitive because kidney and liver function, body composition, vision, dexterity, memory, and balance can change with age. A medicine tolerated for years may need review after weight loss, dehydration, a new illness, or a change in kidney function. The caregiver's job is not to make prescribing decisions. It is to create a reliable system, observe carefully, document accurately, and ask early. Polypharmacy commonly means using 5 or more medicines. It is associated with more adverse effects, interactions, falls, and cognitive problems. The number alone does not determine whether treatment is appropriate. Include prescriptions, over-the-counter products, vitamins, herbals, creams, drops, inhalers, injections, and medicines taken only as needed. Let's build a record. Create one master list. For every product, record the brand and generic name when known. Strength, dose, route, time, reason, prescriber, pharmacy, start date, and special instructions such as take with food, avoid grapefruit, or check blood pressure first. Add allergies and the reaction, not simply the word allergy. Add medical conditions, emergency contacts, and the date the list was updated. Update it whenever a medicine is started, stopped, or changed. Compare and resolve discrepancies. Then use a separate administration log. Record the scheduled date and time, medicine and dose, initials of the person who gave or observed it, and any relevant measurement or symptom. Document immediately after the dose is taken, not before. If a dose is refused, held, dropped, vomited, missed, or given late, record what happened and whom you contacted. Never alter a record to hide an error. Keep a copy at home and another in a wallet, purse, or phone. Share it with every clinician, dentist, urgent care, or hospital team and pharmacist. Update it whenever a medicine is changed. At each transition home, compare the new instructions with the pre-hospital list and resolve every discrepancy before the next dose. Use one pharmacy when practical so the pharmacist can screen the full profile. Ask for a medication review at least annually and after hospitalization, falls, new confusion, major illness, or several prescription changes. Ask what each medicine is for. Ask, is it still needed? Could 2 products duplicate each other? Does kidney function affect the dose? Could any medicine worsen balance, thinking, constipation, bleeding, or low blood pressure? Let's discuss the safe dose routine. Before each dose, pause and verify the right person, medicine, dose, route, and time. Also verify the reason, relevant instructions, and that the dose has not already been given. Read the label every time. Do not identify a pill by color alone. If a pill looks different, the label is unclear, or directions conflict with the care plan, stop and call the pharmacist. Wash and dry your hands. Prepare medicines in a quiet, well-lit area without food preparation, television, or pets competing for attention. Work with one person at a time. Use an accurate oral syringe or dosing cup for liquids, not a kitchen spoon. Read the measurement at eye level. A pill organizer, blister pack, alarm, or dispensing device can help, but only when a pharmacist confirms suitability. Keep original packaging. Encourage the older adult to participate as safely as possible. Independence is valuable, but supervision should match ability. Never borrow, share, or use another's prescription. Never combine pills in unlabeled containers, and never stop abruptly. Let's pause for a quick knowledge check. Does taking 5 or more medicines automatically mean some should be stopped? Pause and decide now. The answer is no. It signals the need for careful review, and only a qualified clinician should change the regimen. Interactions and high-risk patterns. An interaction can make a medicine stronger, weaker, or more toxic. It may involve prescriptions, over-the-counter products, food, alcohol, supplements, or a medical condition. Have the pharmacist screen the complete list. Common hidden problems include duplicate ingredients. A cold remedy may contain acetaminophen while already taking it for pain. Read labels carefully. Medicines associated with dizziness, sedation, low blood pressure, or impaired coordination can contribute to falls. Do not stop abruptly. New confusion may be medication related, but it can also signal infection or stroke. Call the clinician promptly for sudden confusion or hallucinations. Food matters. Grapefruit affects certain medicines, and alcohol can intensify sedation or liver injury. Herbals can interact too. Question 2. Where should most medicines be stored? Think about it for a few seconds. In a cool, dry, secure place, away from heat, direct light, humidity, children, pets, and unauthorized access while following each product's label. Never crush, split, open, or dissolve a medicine into food unless approved. Extended release products may release too much medicine at once. Enteric coatings protect. If splitting is authorized, use the recommended device and do not split in advance. If swallowing is difficult, stop improvising. Ask about a liquid, smaller tablet, dissolving form, or patch. Report coughing or choking. Do not hide medicine in food without consent and professional approval. It may be unsafe and can undermine trust. Question 3. What is the difference between a medication list and a log? Take a moment to decide. The list describes what is currently ordered. The log records what was actually taken, held, refused, missed, or associated with symptoms. Follow each label. Some require refrigeration. Keep refrigerated medicine away from food spills. Keep medicines in original containers. Store them up and away from children and pets, and lock controlled substances. Separate look-alike products. Check expiration dates. Use a take-back location or mail-back option. If unavailable, follow FDA label instructions or trash disposal. Do not crush. Mix with an unappealing substance, seal, and remove personal info. Only flush medicines on the FDA flush list. Let's do another check. Question 4. May a scored tablet always be split? Pause and decide. No. Confirm that the exact product and prescribed dose may be split with the pharmacist or prescriber. Let's cover when to call for help. Call the pharmacist for routine questions about timing, food, storage, refills, missed doses, or interactions. Call the prescriber promptly for a new rash, persistent nausea, dizziness, worsening swelling, unusual bruising, new confusion, or symptoms after a change. Call 911 for trouble breathing, swelling of the face, lips, tongue, or throat, collapse, seizure, unresponsiveness, signs of stroke, severe chest pain, uncontrolled bleeding, or any rapidly worsening life-threatening reaction. Call Poison Control at 1-800-222-1222 for suspected overdose. If a dose is missed, vomited, or given incorrectly, do not guess and do not automatically give another dose. Note the medicine, strength, actual time, and symptoms, and call for advice. Nausea is a side effect. Hives indicate a serious allergy. Record specific details. Medication safety pause. Right person, right medicine, right dose, right route, right time, right reason. Check the label, check the log, and ask. Question 5. What should you do after a suspected double dose? Decide your action now. Do not guess or wait for symptoms. Gather facts, then promptly call the pharmacist, prescriber, poison control, or 911. Remember the key takeaways. Polypharmacy increases risk. Store each medicine according to its label. Maintain a list and log, and never crush or split without approval. A safe medication system is calm, consistent, documented, and shared with the healthcare team. When uncertain, pause and ask. Thank you for completing Lesson 13. Be sure to download your lesson workbook at famcareclass.com. Consult your clinician for specific medical decisions.